Health financing amid the prevailing COVID-19 pandemic is vital to face the health emergencies by the central and state governments. NK Singh, Chairman, 15th Finance Commission of India, is joining us to talk about policy reforms and budgetary outlay of the Union government towards the healthcare sector and to kickstart the economies.
Dr. NK Singh, Honorable Chairman, the 15th Finance Commission. Welcome to ETGovernment show, Doctor. Thank you for giving opportunity to interact with you.
Thank you. Most welcome.
Dr. NK Singh, you are the first Finance Commission after India's independence to witness the COVID-19 pandemic. What is your preliminary first-hand analysis or evaluation on the present crisis, if you may speak?
So I think that this is really one of the most unexpected pandemic which came to us. That is why, in recognition of this pandemic, you're absolutely right. The title of our report we propose, subject to the Commission's approval, is Finance Commission in Pandemic Times. So unlike any other commission in the past, we recognize that this is under the pandemic times which recognize. Now there are three dimensions to it. First and foremost is a human dimension. The human dimension means that the obligations of the state, the obligations of the bureaucracy, the obligations of every entity is what can be done to prevent casualty in terms of human life and to mitigate the suffering. Now, this has further dimensions to which I'll come to later, particularly the inadequacies this has shown in our health systems. And the fact that these inadequacies existed was perhaps known, but it took a pandemic, unfortunately, to show up these failings of infrastructure in the health and health-regulated systems. The second very broad dimension of the pandemic is that it has really it has affected in a significant way all available economic parameters in terms of rates of economic growth, in terms of the revenue which is expected, in terms of the needs of various other sectors getting affected, the expenditure pressures which it has created, the necessity for reprioritization of expenditure, and how to really balance out the compulsions of growth with the compulsions of pandemic. So that's the second broad framework. The third broad framework with this pandemic has done, it has pressed many challenges in the federal architecture. State governments are under a very distressful state given their shortfall in revenues and given the need to enhance expenditure on the pandemic. Equally, the central government's finances are deeply stretched to even meet their inescapable requirements. So the problem is that it has really forced people to look at the kind of new ways in which the federal architecture can be reset, taking into account the consequences of this pandemic. The fourth important dimension of this pandemic is, I believe, in the conduct of human relationship. Many people have talked, Dr. Radhakrishnan, many people have talked about the need for a reset button. Now, what does reset mean? Reset means that many have interpreted this by saying that we need to rewrite the social contract. The social contract, which, as we know, was written by Rousseau a long time ago. It was defined by John Locke and by Hobbes, two important European philosophers and sociologists. It meant a certain relationship between the citizen and the government, and that it is only with the consent of the citizens that governments govern. So this is the fundamental precept of this. But what the pandemic has done, that in terms of the compulsions on social security system, in terms of the compulsions on credible insurance systems, in terms of what it means to really succor relief for the informal sector of the economy for a country like India. You see, for instance, the entire migration crisis. The issues of migration needs to be visited in a comprehensive way, because the picture of thousands and thousands of migrants traversing long distance to try and reach their home position was something which really gave a lump to everybody's heart and the feeling. And the entire issue of migration emanates from the necessity and the need, perhaps, to reset the button, and consider the resetting of the entire social contract. And finally, this pandemic, it's the fifth dimension, has forced us to rethink on the entire architecture of globalization, on whether we have entered a period of the geopolitical uncertainties, we've entered a period of deglobalization instead of further globalization, and what would be the contours of the new world, or the new normal, as many people use it, post the pandemic era. I'll stop here.
Thank you.
Yeah,
NK,
go ahead.
here, your commission is going to study spending on health through centrally sponsored schemes. And how do you go about the study and its strategic approach, its objectives, if you can highlight?
So there are a few things. For instance, for the reasons which I have outlined above and which I have mentioned in this my comments, it shouldn't be surprising to anyone that this will be the first commission which will have a separate chapter on health. Health is going to receive a very, very important attention of the Finance Commission. But to give you a broad ballpark picture, you will be surprised to know that public outlay on health has remained less than 1% of GDP. It's currently around 0.9% of GDP, 0.6% of GDP coming from the states and 0.3% coming from the union. So the total is less than 1%. Now, clearly, we had taken a commitment a long time ago that the expenditure on health as a percentage of GDP should be above 2%. So the first thing that it highlights is that it will have to be dealt with in the health chapter is how do you ramp up the health expenditure well above the 0.9% of GDP. Second important area is that how do you address the issues of spatial and geographical distortions in the availability of manpower. If you look at an all India average, the per thousand population in the more advanced states, the percentage of doctors and nurses which are available could be 3 times, 4 times, or even 5 times what it would be available in the poorer parts of India, particularly Bihar and UP, and of course some parts of Orissa. So the huge distortions in the spatial distortions in terms of the availability of the health manpower, both in terms of doctors and allied services, paramedics and nurses. Along with this is the issue of the hospital infrastructure, the total number of beds which are available per thousand population, the neglect of the primary health centers, which should have been the first line, because not everybody needs rush to the district, certainly not rush to the capital town of the state, certainly not rush to Delhi or anywhere else or to metropolitan, but I think is how to strengthen the primary health centers, which is the cutting edge, is something which has been brought out very dramatically. Then there are the failings related to the fact that many districts do not have, certainly I think that that's a huge gap, separate wards and treatment for infectious diseases. You need to not neglect the non-communicable diseases because they also need to be addressed, but communicable diseases, which are the infectious diseases, we need to fill that up. We need to have laboratories and testing arrangements at the local level. Not everybody needs to come to the district or to the state capital to be able to get tested. testing laboratories need to be decentralized. And so I think that these are some of the facts and failings which pertain to the availability of the health infrastructure. Coupled with this, there are two more, and I'll stop there. One is the fact that India, unfortunately, I was reading the history of Indian health systems, and you'll be surprised to know that as early as 1770, there was an Indian health system. It carried on in many ways from the time of the government when taken over with the colonial imperial service once upon a time after the British. And thereafter, that has gone away. So we do not have really an architecture for the engagement and employment of doctors whose prospects do not look to be very good. Right now, it's not the most favored profession. I'm not only talking of the enormous pain which the health warriors or the COVID warriors, as they are called, have encountered. But even looking at it otherwise, the Indian Civil Service Act of 1951, for instance, had stipulated that there was need to consider an all India health service. We do not have an all India health service. Large number of important health doctors are still on contractual appointments, which is not something which is most desirable. We need to have, many other countries have a national health service. We need to have an all India health service. Along with this is the need to have an equal number for paramedics. Our boys and girls, particularly girls, are as capable. I mean, you'll be surprised to know, Akshan, that, for instance, the economies of many countries in the world is run on the remittances of the allied workers, which is being sent to them. I think that is a very small investment. If every district hospital can begin to replicate the teaching course of a nursing college, you would suddenly find that the total number of nurses and allied workers and paramedics can be increased dramatically with very limited investments. These are some of the aspects I think that which is receiving the attention of this commission, and we will see what best recommendations we can make.
NK, I wish to bring it to your notice. Every year, Government of India and 36 state governments crores of rupees in their financial budgets towards the Department of Health and Family Welfare to provide public health care system in their state respectively. Do you think the current COVID-19 pandemic is a wake-up call to them to, we are not enough strengthened, we are yet to go back to strengthen powerfully to meet any future such crises?
Well, if this isn't a wake-up call, I would like to ask myself, what then can be a wake-up call? I mean, this is a compulsive need of the hour. It is a need of the hour, not only to improve outlays on health at the central level, at the state level, and forging more meaningful public-private partnership, because merely expecting private sector to fill the health gap would be not an adequate way of the state discharging its own responsibilities. Elected states, elected governments in the state governments, elected representatives of the third tier, panchayats, urban local bodies, mayors, and so on. It would not be an appropriate way for elected representatives of government to discharge their governance responsibility if they are not more directly engaged. So this is a wake-up call, both in terms of enhancing public outlay on health, reprioritizing health as an important expenditure, and addressing some of the things which I mentioned in my earlier comment.
Thank you, NK. Under your guidance, the high-level committee on health sector will submit sustainable recommendations for the health sector. Can we expect in next quarter?
So the high-level committee, which I had constituted under Dr. Guleria, of the director of the AIMS, which had eminent names like Dr. Devi Shetty, Dr. Srinath Reddy, Dr. Naresh Trehan, Marcel Ka, the Vice Chancellor of the Bombay University, eminent professor from Calcutta, along with representatives of the ICMR from state governments, had several sessions to discuss the wide gamut of subjects. We also had the great advantage of intensive discussions with Dr. Paul, V.K. Paul, the director of Niti Aayog, with Dr. Indu Bhushan, who is heading the Ayushman. As a result of all this, their report is now available with us, and it is for the Commission to now consider and take an appropriate view as we go forward.
Okay. The Finance Commission gives its recommendation on distribution of tax revenues between union and state and among the state themselves. Two distinctive features of your commission work involve redressing the vertical imbalances between the taxation powers and expenditure responsibilities of the central and state respectively, and equalization of public services across the state. Has COVID given us so much impact on the state economy? Do you think that they can recover what could be the roadmap to recover fast?
Well, let me put it this way to you, that in addition to what you have mentioned, as what we give by way of the vertical imbalance, and what you have given by way of what is called the horizontal devolution to the individual states based on a certain formula, we give other grants too. These are grants for the third tier, for panchayats, for urban local bodies. We give grants for the disaster management functions, and COVID has been declared as a pandemic has been declared as a disaster. In addition, we give what are known as revenue deficit grants, and occasionally we give what are called sector-specific grants to address some important sector, like earlier it had been given for education and so on and so forth. Let us see, therefore, that in addition, what we can do to both incentivize state governments to reprioritize health, to make an expenditure on health to be a larger proportion of their total overall expenditure, along with recommendations of what we can do give to the central government to accord higher priority in their public outlay as regards health is concerned, apart from number of changes on regulatory and other functions which can prioritize health as an important ingredient as we begin to grapple with the pandemic. The pandemic is not over. The pandemic has cast a huge shadow of uncertainty. The pandemic has got unpredictability. This is one of the most unpredictable pandemics because it comes at a time when all vaccines are still under trial, when there are no known efficacious medicine which would be against this. So these are the challenges, and the Finance Commission is trying to grapple, giving a 5-year award addressing many of these multiple uncertainties and multiple challenges.
The vaccine is expected in the near future. Timelines are not known. Is Commission working on vaccine enablement to every citizen in the country in terms of a recommendation to the government? Do you have any suggestion? Do you have any suggestion in your one of the recommendations, vaccine availability to the public?
This is the issue of vaccine is not within the ambit of the Finance Commission. And we are deeply conscious of our constitutional obligations and constitutional limitations. But in dealing with the issue of the health chapter, certainly these are considerations which the Commission always keeps in mind.
Dr. NK Singh, Honorable Chairman, 15th Finance Commission, thank you very much for giving opportunity to interact with you. Thank you, sir.
Feel free to visit our partner booth for more information on such relevant topics. No harm in dropping by and saying hey to our experts. They will be happy to connect with you. Do share your feedback about the session at the end. You can also interact with us on social media using the hashtag ETGIIHS. I would like to hold on to Radhakrishnan sir for the closing remarks.
Distinguished guests, speakers, and leadership of central and state health departments and National Health Mission, on behalf of ET Government, I rise to formally propose a vote of thanks ET Health World Innovation and Intelligence Summit for day one for making it a grand success. I take this opportunity to thank our gold partners, Mylan and VMware, and associate partner BPL Medical Technologies for their support. I also take this opportunity to thank our support partners, including Government of Telangana, Technology Development Board, Telemedicine Society of India, CSC e-Governance Services India, Leading India, Government Blockchain Association, and other partners for their support. For the past few hours, we had discussions over the range of subjects covering the entire spectrum of public healthcare system and its future roadmap covering central and state governments. As many as 20 eminent speakers participated in day one, as many as 5 sessions on the day one. The ET Health World Innovation and Healthcare Virtual Summit has noticed that technology adoption is boosting the public healthcare system, enabling new trends like electronic ICUs, integrated ICUs. Rajasthan is gearing up for the future ready healthcare. Andhra Pradesh enhanced its budget in healthcare by 54%. Karnataka is witnessing highest number of technology-driven war room for healthcare purposes. Ayushman Bharat Pradhan Mantri Yojana, the National Digital Health Mission, telemedicine initiatives are some examples from Government of India. The alignment of state governments and union territories with the central government's National Portability Initiative in healthcare is a good and encouraging sign for healthcare. That's not all. On day two, tomorrow, we shall have exciting discussions on important themes of digital transformation and emerging technologies, including artificial intelligence, machine learning, big data, and others. I once again thank our distinguished guests, eminent speakers, and delegates for making the summit a memorable one. Keep watching etgovernment.com for latest updates on e-governance, digital transformation, and technology in healthcare. We shall meet you soon with another exciting opportunity. Thank you very much. I'm T. Radhakrishna, editor, ET Government. Thank you.
Well, that brings the day one of the summit to a close. I would like to thank our stellar lineup of speakers for sharing their insights today. But I would especially like to thank all of you, ladies and gentlemen, for being such an incredible audience. We will be back tomorrow with movers and shakers of the health technology industry who are shaping the industry. We will be back with more insightful sessions tomorrow with our experts. Do tune in tomorrow to stay up to date with the latest health tech trends. Besides interesting sessions, we have awards night for you. ETHealthWorld.com Intelligent Health and Tech Awards 2020 will honor the hard work, innovation, and excellence of healthcare-focused AI and tech enterprises and individuals across 25 plus categories. Make sure you come back tomorrow to find out the winners of the industry. How can we forget our partners who are making it possible for us to be connected with you? Big thanks to our partner for collaborating with us and making our vision a reality. Gold partner, Mylan VMware. Associate partner, BPL Medical Technologies. Supporting partner, Technology Development Board, CSC e-Healthcare, Telemedicine Society of India, Indian Pharmaceutical Association, Indian Drugs Manufacturer Association, Leading Indian AI, Government Blockchain Association, GBA. State partner, Government of Telangana. Have a lovely evening, maintain social distancing, and take all government-sanctioned precautionary measures to be safe. Wish you all the best and stay healthy. Thank you. See you tomorrow.